If you're a new graduate nurse and wondering about your future career options, well, you're not alone. Many nurses today are exploring pathways beyond traditional bedside roles and are looking to advance their careers in exciting specialized fields. So in this video, we'll discuss 3 popular nursing career options, from Family Nurse Practitioner, that FNP, Certified Registered Nurse Anesthetist, that CRNA, and even Aesthetic Nurse Injector, for all you cosmetology lovers out there. Now, I'm going to walk you through the process of pursuing each of these paths and share some pros and cons of each field, really to help you decide which one might be right for you. So let's get started. First up, we have Family Nurse Practitioner, the FNP. So to become an FNP, you'll need to first earn a master's degree in the science of nursing, what's known as an MSN, or even a Doctor of Nursing Practice, a DNP, with an FNP specialization. Now, I know that sounds like a lot, but after that, you'll take a certification exam through the AANP or the ANCC. It typically takes around 2 to 4 years to complete this advanced degree program, depending on whether you study full-time or part-time. So now let's talk about the pros and cons. So starting with the pros, number 1, there's increased autonomy. FNPs can diagnose, you can treat, and even prescribe medications, and often work independently or in collaboration with physicians. Next is the flexibility. You can work in a variety of settings, including family practices, clinics, and even telehealth, which means you see patients remotely on your computer. And lastly is the high demand and good pay. FNPs are in high demand, especially in primary care, and enjoy a competitive salary. Now, switching over to the cons, or basically the bad news here. Number 1 is the intense schooling. So going back to school can be rigorous and expensive, and you just got out of nursing school, so you're gonna have to do more schooling. Number 2 is the high level of responsibility. So as an FNP, you're essentially the HCP, the healthcare provider. So you'll be making critical decisions for the patient, which can be downright stressful. And lastly is the possible burnout. As we know, managing a large patient load can be overwhelming, particularly in underserved areas. Next, let's talk about Certified Registered Nurse Anesthetist, those CRNAs. So the process to become a CRNA, you'll need at least 1 year of critical care experience, either in the ER or ICU. And you have to get this experience as an RN before enrolling in a Doctor of Nursing Practice, a DNP, or a nurse anesthesia program, which takes around 3 years to complete. Now, after completing your degree, you must pass the National Certification Examination to become licensed. Now, what about the pros and cons? Well, starting with the pros. The big thing is the top tier salary. CRNAs are amongst the highest paid nurses in the industry, with substantial earning potential, typically over $150,000 to even $200,000 per year. One of my good friends actually makes over $200,000 a year being a CRNA. Next is the high level of autonomy. CRNAs often work independently, especially in rural or underserved areas. And number 3 is job satisfaction. Many CRNAs find their work challenging and rewarding, particularly with the low impact on the body when managing patient anesthesia needs. For example, you can be working 12-hour shifts on your feet turning patients, or as a CRNA, you are sitting in a chair with the primary focus of maintaining that patient's airway. Now, switching over to the cons, the bad news here. Well, number 1 is, you guessed it, the rigorous education and training. The path to become a CRNA is long and academically demanding. Next is the high stress environment. Working in an operating room and managing anesthesia comes with high stakes and high pressure. So you gotta be cool, calm, and collected under a lot of pressure. And lastly is the significant responsibility. You'll be responsible for the patient's lives during surgery, which requires immense focus and precision. And honestly, that's one of the reasons why I didn't become a CRNA, because I like the fast-paced environment of the ER, and with my ADHD history, it's hard for me to focus. Okay, lastly, let's move on and explore the role of Aesthetic Nurse Injector. So to become an Aesthetic Nurse Injector, you'll typically start by gaining experience as an RN, then complete specialized training in aesthetics, which may include Botox and even dermal filler certification courses. Some nurses also pursue additional certifications through organizations like the American Association Aesthetic Medicine and Surgery, the AAAMS. Okay, now let's go over the pros and cons. So starting with the pros. First is creative and fulfilling work. You as a nurse get to help clients achieve their aesthetic goals, which can be rewarding. Number 2 is the flexible schedule. Many aesthetic nurses work in med spas, private clinics, plastic surgery offices, which often have more predictable hours compared to hospital shifts. And third is the growing field. The demand for aesthetic procedures is on the rise, creating many opportunities for nurses in this specialty. Now, what about the cons, the bad news here? Well, number 1 is the initial investment. Training and certification courses can be costly, and you may need to invest in marketing yourself if you plan to open your own practice. Next is the competitiveness of the field. Aesthetic nursing is becoming more and more popular, which means you'll need to build a strong reputation to really stand out. And third is the limited insurance coverage. Now, this one's huge. Since aesthetic procedures are often elective or basically voluntary, you may face challenges related to patient financing and even liability. All right, so we just covered 3 career path options out of hundreds of possible options here. So to learn more about the pros and cons of different nursing roles across specialties and even care settings, check out my new Grad Nurse Mastery course. Simple Nursing partnered with Elite Learning to create this course specifically to help new grad nurses make the overwhelming transition from student nurse to working as a nurse, with all the advice, tips, and tricks that you'll need along the way. We've literally thought about everything. So let me give you a behind-the-scenes peek at the essential info in this course. So number 1, we show you how to figure out and land your perfect nursing role for your skills and personality. Number 2 is those skill refresher videos that you can quickly check on your phone if you need a quick reminder on how to do a certain skill. Now, this comes in super handy when you're a new grad on the floor and you have to do a skill that you've never done before. So instead of looking up a random YouTube video, simply take your phone and watch a quick refresher video. Next is the advice from experts on conquering new job anxiety and even imposter syndrome. We sat down with 3 of the most prestigious hospitals in the country, and we interviewed their most experienced nurses, the preceptors, and even new grads in those roles. We also sat down with the hiring managers to see exactly which questions they asked during the interview process and how they make their selection. So there's so many juicy tips in this course. Plus, you'll get CE credit for the course as you learn. So talk about an extra bonus. This new grad course is available by itself or as part of the Elite Learning Nursing Career Passport membership, where you can get access to even more new grad skills videos. Also, live Q&A sessions with nursing experts like me, and a whole library of fun ways to get CEUs in convenient formats. For example, podcasts and even videos to help maintain your license. So stop waiting here. You can find out more about this course and our resources for new grads in the career section of your Simple Nursing dashboard. I'll see you guys there.